I do want to focus on the issue of health care because Senator Clinton has suggested that the flyer that we put out, the mailing that we put out, was inaccurate. Now, keep in mind that I have consistently said that Senator Clinton's got a good health care plan. I think I have a good health care plan. I think mine is better. But I've said that 95% of our health care plan is similar. I have endured, over the course of this campaign, repeated negative mail from Senator Clinton in Iowa, in Nevada, and other places, suggesting that I want to leave 15 million people out. According to Senator Clinton, that is accurate. I dispute it, and I think it is inaccurate. On the other hand, I don't fault Senator Clinton for wanting to point out what she thinks is an advantage to her plan. The reason she thinks that there are more people covered under her plan than mine is because of a mandate. That is not a mandate for the government to provide coverage to everybody. It is a mandate that every individual purchase health care. And the mailing that we put out accurately indicates that the main difference between Senator Clinton's plan and mine is the fact that she would force, in some fashion, individuals to purchase health care. If it was not affordable, she would still presumably force them to have it unless there is a hardship exemption, as they've done in Massachusetts, which leaves 20% of the uninsured out. And if that's the case, then, in fact, her claim that she covers everybody is not accurate. Now, Senator Clinton has not indicated how she would enforce this mandate. She hasn't indicated what level of subsidy she would provide to assure that it was, in fact, affordable. And so it is entirely legitimate for us to point out these differences. But I think it's very important to understand the context of this, and that is that Senator Clinton has, her campaign at least, has constantly sent out negative attacks on us, email, robocalls, flyers, television ads, radio calls. And, you know, we haven't whined about it because I understand that's the nature of these campaigns. But to suggest somehow that our mailing is somehow different from the kinds of approaches that Senator Clinton has taken throughout this campaign, I think, is simply not accurate.
And Senator Clinton, on this subject.
I have to respond to that because this is not just any issue, and certainly we've had a vigorous back and forth on both sides of our campaign. But this is an issue that goes to the heart of whether or not this country will finally do what is right, and that is to provide quality, affordable health care to every single person. Senator Obama has a mandate in his plan. It's a mandate on parents to provide health insurance for their children. That's about 150 million people who would be required to do that. The difference between Senator Obama and myself is that I know from the work I've done on health care for many years that if everyone's not in the system, we will continue to let the insurance companies do what's called cherry picking, pick those who get insurance and leave others out. We will continue to have a hidden tax so that when someone goes to the emergency room without insurance, 15 million or however many, that amount of money that will be used to take care of that person will be then spread among all the rest of us. And most importantly, you know, the kind of attack on my health care plan, which the University of Pennsylvania and others have said is misleading, that attack goes right to the heart of whether or not we will be able to achieve universal health care. That's a core Democratic Party value. It's something that ever since Harry Truman we have stood for. And what I find regrettable is that in Senator Obama's mailing that he has sent out across Ohio, it is almost as though the health insurance companies and the Republicans wrote it. Because in my plan, there is enough money, according to the independent experts who've evaluated it, to provide the kind of subsidies so that everyone would be able to afford it. It is not the same as a single state trying to do this because the federal government has many more resources at its disposal. So I think it's imperative that we stand as Democrats for universal health care. I've staked out a claim for that. Senator Edwards did. Others have. But Senator Obama has not.
Senator Obama, quick response.
Well, look, I believe in universal health care, as does Senator Clinton. And this is I think, the point of the debate, is that Senator Clinton repeatedly claims that I don't stand for universal health care. And, you know, for Senator Clinton to say that, I think, is simply not accurate. Every expert has said that anybody who wants health care under my plan will be able to obtain it. President Clinton's own Secretary of Labor has said that my plan does more to reduce costs, and as a consequence, make sure that the people who need health care right now, all across Ohio, all across Texas, Rhode Island, Vermont, all across America, will be able to obtain it. And we do more to reduce costs than any other plan that's been out there. Now, I have no objection to Senator Clinton thinking that her approach is superior, but the fact of the matter is that if, as we've heard tonight, we still don't know how Senator Clinton intends to enforce a mandate, and if we don't know the level of subsidies that she's going to provide, then you can have a situation, which we're seeing right now in the state of Massachusetts, where people are being fined for not having purchased health care, but choose to accept the fine because they still can't afford it, even with the subsidies. And they are then worse off. They then have no health care and are paying a fine above and beyond that. That is a genuine difference between myself and Senator Clinton. And the last point I would make is the insurance companies actually are happy to have a mandate. The insurance companies don't mind making sure that everybody has to purchase their product. That's not something they're objecting to. The question is, are we going to make sure that it is affordable for everybody? And that's my goal when I'm President of the United States.
Senator,
Brian,
you
wait
two...
a minute. I've got this is too important. You know, Senator Obama has a mandate. He would enforce the mandate by requiring parents to buy insurance for their children. That is the case. If you have a mandate, it has to be enforceable. So there's no difference here. It's just that I know that parents who get sick have terrible consequences for their children. So you can insure the children, and then you've got the breadwinner who can't afford health insurance or doesn't have it for him or herself. And in fact, it would be as though Franklin Roosevelt said, let's make Social Security voluntary. Let's let everybody get in it if they can afford it. Or President Johnson said, let's make Medicare voluntary. What we have said is that at the point of employment, at the point of contact with various government agencies, we would have people signed up. It's like when you get a 401k at your employer, the employer automatically enrolls you. You would be enrolled. And under my plan, it is affordable because, number one, we have enough money in our plan. A comparison of the plans like the ones we're proposing found that actually I would cover nearly everybody at a much lower cost than Senator Obama's plan, because we would not only provide these health care tax credits, but I would limit the amount of money that anyone ever has to pay for a premium to a low percentage of your income. So it will be affordable. Now, if you want to say that we shouldn't try to get everyone into health insurance, that's a big difference, because I believe if we don't have universal health care, we will never provide prevention. I have the most aggressive measures to reduce costs and improve quality, and time again, people who have compared our two approaches have concluded that.
Brian,
so let's have a debate about the facts.
The last answer on this topic.
It is just not accurate to say that Senator Clinton does more to control costs than mine. That is not the case. There are many experts who've concluded that she does not. I do provide a mandate for children because, number one, we have created a number of programs in which we can have greater assurance that those children will be covered at an affordable price. On the point of many adults, we don't want to put in a situation in which on the front end we are mandating them, we are forcing them to purchase insurance, and if the subsidies are inadequate, the burden is on them and they will be penalized. And that is what Senator Clinton's plan does. Now, I am happy to have a discussion with Senator Clinton about how we can both achieve the goal of universal health care. What I do not accept, and which is what Senator Clinton has consistently done, and in fact, the same experts she cites basically say there's no real difference between our plans, that they are not substantial. But it has to do with how we are going to achieve universal health care. That is an area where I believe that if we make it affordable, people will purchase it. In fact, Medicare Part B is not mandated. It is voluntary, and yet people over 65 choose to purchase it, Hillary. And the reason they choose to purchase it is because it's a good deal. And if people in Cleveland or anywhere in Ohio end up seeing a plan that is affordable for them, I promise you they are snatching it up because they are desperate to get health care, and that's what I intend to provide as
Senator,
about 20% of the people who are uninsured have the means to buy insurance. They're often young people who think they're immortal.
Which is why I cover
when the illness or the accident strikes. And what Senator Obama has said, that then once you get to the hospital, you'll be forced to buy insurance. I don't think that's a good idea. We ought to plan for it, and we ought to make sure we cover everyone. That is the only way to get to universal health care coverage. That is what I've worked for 15 years, and I believe that we can achieve it. But if we don't even have a plan to get there, and we start out by leaving people, you'll never, ever control costs, improve quality, and cover everyone.
With respect to the young people, my plan specifically says that up until the age of 25, you will be able to be covered under your parents' insurance plan. So that cohort that Senator Clinton is talking about will